there's a sub-focus, which we're calling the Integrated Behavioral Health Initiative, and Scott will tell you some of the details on that. That's a new one for us this year. Our second focus is American Indian Health, and our third is called Partnerships for Better Health, and we'll explain what we mean by that as we go through the webinar. We're offering two types of grants this year, a rapid response fund for grants of up to $50,000 for up to a 2-year grant term, and for those there will be a one-step application process that's offered 2 and possibly a third time over the course of the year. The second is the larger grants. Those are starting at about $50,000 and anything above $50,000, and then going up to a maximum of $150,000 for a 2-year grant. These are our eligibility criteria. So grants are open to Montana-based organizations that meet one of these criteria, either a 501c3, and that excludes certain types of 501c3s that are defined in the Internal Revenue Code, including private foundations and Type 3 non-integrated supporting organizations. Did I get that right, Ted? No. Thank you. And tax-exempt educational institutions, such as a college or university, and state, tribal, or local government agencies. Just a special note for the American Indian Health Focus Area, if you'd like to apply for a grant in that focus, only tribal government agencies and American Indian-led nonprofits are available, or American Indian-led colleges. Eligible applicants can plan to use part of their budget for contracts with entities that might not be eligible to apply on their own. So, for example, if you have a consultant that you feel is best for the job and they're either not Montana-based or they're not a 501c3, that's okay as part of your budget. But again, they couldn't be the primary grant applicant. This is kind of a list of things that at the current time we are not funding. So we don't give grants to individuals. They wouldn't meet those eligibility criteria. We don't fund capital campaigns or fundraising events. We don't fund operating deficits or retirement of debt. We are not at the current time financing construction projects or real estate acquisitions. We are investigating the possibilities of doing that at some point in the future. We don't fund organizations that discriminate for any reason. We don't fund lobbying or political activities as defined in the Internal Revenue Code. We don't fund large equipment purchases, although the purchase of equipment as a relatively minor part of your budget may be okay, as long as that's not the main purpose for which you're applying. We don't fund medical research or research that lacks a direct, targeted, and practical benefit for Montanans' health. And we don't fund organizations or foundations that intend to redistribute our grant in the form of subgrants. One special note, the Montana legislature imposed a special consideration for this foundation, and that is with regard to what's called supplanting. Our grants may not be used to supplant government funds. We have a paper on this. You'll be required to read it as part of the application process, and the basics are as follows. We don't want you to use our grant to replace funding that you already have in place and then take those government funds and use them for something different. You can use our funds to supplement government funding. That is, so just to make sure the definitions here are clear because they're tricky, supplanting is to supersede or replace. That's not allowed. Supplementing is to add or augment. So if you want to use our grant to do something related to projects that you have government funding for, but you will accomplish specific new outcomes and deliverables that couldn't be accomplished with your current funding, that is supplementing, not supplanting, and that is allowed. These are our selection criteria, and if you take nothing else away from today, I urge you to read these in detail in the call for proposals. This is a list of them, but we describe each of them in detail in the call for proposals, and please do read them. This is really the way that we view each and every proposal we receive. First of all, the importance of the health issue that you seek to address. We will gauge through your description how important is this to the community, and that's one of the things we weigh in deciding to fund a project. The second is the need. Is this issue that you want to address something where it appears that your community may have the resources to deal with it without our grant, or is there really a true need where our grant is the only way you're going to be able to get to a solution, or the best way? The potential for lasting change. We seek to support projects that where the benefits will be sustainable long after our grant is done. Sustainability is a very important criterion for us. There's a lot of money being spent on healthcare, and yet there's still a lot of health outcomes that need improving. Our focus last year and certainly this year as well is on standing up projects that can then sustain themselves. Maybe that's through billing third-party insurance or another resource. Maybe it's through a shared savings agreement with the health system where you think your project will actually generate better outcomes and reduce healthcare spending. Maybe it's through another way, but really do focus on that sustainability criterion. We don't want to fund new programs that would go away once our grant is gone. We have a strong focus, as I said at the beginning of the call, on at-risk populations and health disparities. So we will be looking for proposals that seek to serve populations that have no other resources available to deal with the challenge that you hope to address. We also want some evidence that there's a solution to the problem you want to address. This doesn't mean that you have to cite a bunch of studies that prove that your solution is evidence-based, but evidence-based is good if you've got evidence. If this is a new solution, we want you to explain to us as well as you can why you know it's going to work. We're also focused, though, on not assuming that because an idea works well in Los Angeles or New York City that it's going to work well in rural Montana. We want evidence that the solution you're proposing is something that will work well here, given the resources and constraints and unique, cultural and geographic features of the community that you work in Montana. We look at feasibility. You may have the best idea in the world and propose a $10,000 grant for it, but if we don't think you can do it for $10,000, that would pose a serious concern. So please, scale your ambitions to be realistic and achievable. We also, at the same time, look for projects that, if they were successful in one place with our grant, they might prove a concept that could be employed by other communities around the state. So the idea that they could be scaled to be used by other communities is also important to us. And finally, we aim to have a diverse grantee portfolio across a range of topics, regions of the state, organization types and sizes of organizations. So we fund very small organizations, very small county governments and tribal governments, as well as larger organizations like the university. So this is a slide on our focus areas. Again, as I said, behavioral health, American Indian health, and partnerships for better health. Let's go through each of these in a little bit more detail. In our strategic planning process, we spent a lot of time looking at available data sets, talking to stakeholders around the state, healthcare providers, researchers, county governments, tribal governments, and many others to understand what are the key challenges. These are some of the things we learned about behavioral health. The state does have a high suicide rate, one of the highest in the nation for more than a decade. The rates of adverse childhood experiences were found to be very high in one study, and these have health consequences throughout the life course. Drug and alcohol use are prevalent in some populations, and drug use in pregnancy is another concern that we heard about in many communities. There's a dramatic shortage of behavioral health providers in many parts of rural Montana. There are also funding and reimbursement shortfalls that make it difficult to provide the full range of behavioral health services that people would benefit from. Montana has a very high population of returning veterans, and they are at risk for traumatic brain injury and post-traumatic stress, and other behavioral health challenges. We also have a somewhat fragmented system of care. For example, substance use treatment is often delivered entirely apart from treatment for mental illness or primary care. And the systems and reimbursement structures and facilities that deliver services are all quite separate. And that's not optimal for people who may be struggling with co-occurring physical, mental, or substance use disorder challenges. So this is a list of high-value topics that we identified in our conversations with stakeholders. I really want to emphasize when you read this in our call for proposals or listen to me on this slide that you understand that these are just some of the important areas. We'll consider other topics. This is not, in other words, a restrictive list. This is just a list of examples of things that we think are particularly important to be looking at. Integrated behavioral health, we'll talk to you about that on the next slide. There are, other types of collaboration between mental health centers, health departments, hospitals, and community health centers that might strengthen behavioral health services and improve the value of the care that's being delivered. School-based behavioral health programs and programs that support trauma-informed schools are particularly promising, and there's some great examples from other rural states like Wisconsin of the impact that trauma-informed practices and school-based behavioral health services can achieve. Jail diversion pilot programs that place behavioral health experts in the correction system and help appropriately manage and triage people with mental illness who are at some point in either being arrested or jailed. Prevention and treatment for drug and alcohol use in pregnancy. Again, this appears to be a very prominent problem in many communities and one that we feel warrants particular attention. And finally, partnerships beyond the health sector that address upstream risk factors for mental illness and addiction. Things like homelessness and ways that the health system can partner with community developers, hospitals, and housers to address some of these health-harming social and economic needs. Scott, do you want to talk a little bit about the Integrated Behavioral Health Initiative, which is new this year?
Yes, thank you. This is Scott. So the Integrated Behavioral Health Initiative, I want to make clear that this is one part of the behavioral health focus area, and Aaron just went through the other part. So this is kind of a subset that's available this year. And we're defining integrated behavioral health as a team-based approach that integrates primary care, mental health, and/or substance use disorder treatment in order to improve the health and outcomes and value. And so there's two approaches to this year. One is for a planning grant, and that is a one-year grant that's up to $35,000, and grantees will receive training, technical assistance by a national organization to be determined. The two pieces of a planning grant that are applicable are, one, an organization that is not currently or has minimal integrated behavioral health services, and so this would be a perfect grant for those organizations. The other opportunity for a planning grant would be for an organization that is already doing some sort of integrated behavioral health, but they want to enhance or they want to work on parts of that integrated behavioral health services that are not currently optimal for their organization, or it could be not optimal for their partners. The second opportunity that's available are the implementation grants, and these are two-year grants up to $150,000. Again, with these grants, these are for the training and technical assistance organizations that are ready to implement integrated behavioral health after the planning. These are for organizations that, again, are not currently engaged in any integrated behavioral health services, and they're ready to plan and implement in the two-year process. The other part of the implementation grants that would be applicable are for organizations that are already doing integrated behavioral health. But the key here is that the implementation would be something substantially different than what they are doing right now. So it would be a substantially different service, a substantially different scope or partner that would be much different than the current integrated behavioral health services or program that they have. Some examples of this, and this is not a comprehensive list, but This obviously includes collaborations between primary care clinics, hospitals, tribal health, substance use providers, and mental health providers to provide integrated care. We currently have grantees from our 2015 cycle that are doing integrated behavioral health. Again, there are full descriptions of these grantees on our website, but I would just point out that these range from anything from a community-wide approach toward integrated behavioral health, which brings all the health leaders together to really map out a plan for their community, not just agency-specific. There's other examples of an FQHC in a community that's currently doing some level of integrated behavioral health that's going to partner with a crisis facility and a mental health center that are not currently doing integrated behavioral health. Another example would be a rural access hospital that is not doing integrated behavioral health that is going to partner with their community mental health center that is not doing any integrated behavioral health presently. And again, full descriptions of those are on our website. I would also like to point out that it's our intent as part of this initiative that any grantees from 2016 would be a part of a cohort group to include the 2015 grantees and any of the 2016 grantees. And that would include the training and technical assistance, but also webinars and learning communities, and then to participate in some level of evaluation as well so that we can start to determine the effectiveness of the initiative. Thank you.
Thank you very much, Scott. So this is a new thing for us this year, but I think it's very exciting to be able to provide a lot of training and technical assistance by a national organization to our grantees in addition to the grant funding. I'm going to turn now to the American Indian Health focus area, the second of our three focus areas. And actually, at the start, just so I don't forget, let me remind people on the call who are particularly interested in this area that we'll also be having a call, not a webinar, to go over a little bit more detail and also just give people a chance to interact verbally in case WebEx technology isn't working with your internet connection. Melinda, when is that call?
The call is February 23rd at 1 p.m.
Great, and you can register for that on our website. Sorry to put you on the spot there. Okay, so just some of the key challenges we've heard, and we've spent a great deal of time working with the tribal leaders, the tribal health directors, the urban Indian health center directors, and other stakeholders and leaders working on American Indian health. We also did a tribal consultation recently that helped facilitate a consultation between the Montana state government and tribes on the issue of tribal health disparities. Our report on that is on our website. That's also another nice, very important summary by tribal leaders of some of the health challenges facing their communities. These are some of the issues that we've heard about. Inadequate funding of health services, which is a chronic and long-standing problem, and inadequate funding of disease prevention as well. Prevalent drug and alcohol use disorders and limited availability of treatment. And drug use in pregnancy, again, something that's come up all around Montana, not only in American Indian communities by any means, but a prevalent issue for some of our tribal communities. There are many challenges that young families face: historical trauma, lack of economic opportunity, and adverse childhood experiences. Traffic injury and risks that include driving under the influence and low seatbelt use. Diabetes, obesity, and limited access to healthy foods. Prevalent oral health problems like tooth decay, and suicide and mental illness. Again, these are examples of some particularly high priority issues and opportunities that we identified, but this list is not meant to restrict you to only the things on the list. If you have other ideas, we are very, very open to hear them. We're happy to have a phone call. We're happy for you just to submit a proposal, whatever works best for you. Examples of projects that we did find appear to be very important: helping tribal health departments strengthen funding and programming. So this includes helping them develop a strong Medicaid billing function, third-party insurance billing, helping them utilize Public Law 638 to contract or compact to provide services that the IHS currently provides, and other administrative issues. strengthen the tribal provision of health services and health improvement efforts. Health system planning, so giving you some funds to take a couple steps out of crisis mode and begin to proactively identify the issues that you need to address and how you'd like to address them. Projects that seek to improve maternal and child health outcomes. Injury prevention programs, provided that they can be sustained after the grant. Our grant can be used to start up, but not as a source of sustaining funding. Strengthening health services for urban Indians. And culturally specific disease prevention, treatment, and wellness problems. We're often asked, you know, if there's not evidence that a culturally based intervention is going to help, will you fund it? And the answer is yes, as long as you can make an argument for why that approach is needed and why you think it's going to work. Again, we'll have a special call if you'd like more information, and we also welcome just one-on-one calls. Feel free to give us a ring. Let's turn to the third focus area, partnerships for better health, where we aim really to, we're increasingly using the terminology value-based care, the idea being that we spend a lot of money on health care and we'd like to see outcomes improving more for the dollars that we spend. This is improving value, and that's what we aim to do with this initiative. Some of the key challenges that really drove us to invest in this somewhat broad focus area: limited access to health services in rural areas, where if perhaps there were strong partnerships between organizations like a health department, a critical access hospital, a community health center, or a tribal health department, you might be able to, or a mental health center, you might be able to strengthen and expand what you can provide for your community. Workforce issues, it's of course very difficult to recruit and retain staff. Funding, low reimbursement for mental health and substance abuse treatment. Rising per capita health costs. I think the statistics that we saw recently is that Montana's health costs, like the rest of the countries, are going up, but ours have gone up faster than all but 9 other states. High utilizers, people who frequently encounter the health system in the emergency room or hospital but aren't necessarily getting better outcomes for all of that care. And health disparities and what we call the social determinants of health, the challenge of improving health against the current of poverty, poor housing, or educational outcomes. And so we're interested in interventions that will address those areas as well. So these are just a few examples of projects that we would consider under Partnerships for Better Health. One thing I should have mentioned earlier, but I'll mention it now, is that a really good place to see the types of projects we fund under each of these focus areas is our new grantee list, which you can find easily on our website. We've got a database, a navigable map, and you can take a look there and see what we funded in the past under each of these focus areas. Partnerships for Better Health is a diverse focus area, so it's really worth looking at the grantees there. So one example is just recognizing that there's a lot of health work that needs to be done outside the walls of a clinic or hospital, and community health teams or other forms of community outreach to improve clinical outcomes. We funded a number of projects like this. For example, an RSVP program that trains senior volunteers to go out and follow up with seniors who are recently discharged from the hospital and make sure that they're safe at home, have their medicines, understand how to take them, and so on. Another one was a community-based paramedicine project, which uses paramedics to do hospital follow-ups, monitoring after an ER visit, and again, just home safety and making sure that people are safe and stable at home. Understanding the upstream risks and social determinants, or addressing them. So, for example, projects that would address health-related housing needs, trauma-informed education, been shown to improve educational outcomes, behavioral outcomes in school, and even health outcomes. Collaboration among community agencies, such as local hospitals, local health departments, community health centers, and mental health centers. Programs that would address oral health needs. Again, we are looking for sustainable programs, but if we can help start a pilot that has a clear path to sustainability through billing or another means, that's great. And another one that we added here is just efforts to help the Medicaid expansion be successful. There are a lot of people that stand to benefit, but it will take a lot of work to make sure that people get enrolled, understand how to use their insurance, and understand how to navigate the system. I'm going to turn it over to Ted now, who's going to just go over some of the basics of how to apply, and then we'll try to leave a little bit of time for your questions. Again, if we don't get to your questions today, please ask us at another time.
Thanks, Aaron. So we do all our grant process, applications, grant agreements, and follow-up reports through an online grant system called Fondant. From your perspective, you'll either see the word Fondant or Grant Administration. You might get some emails from that to confirm when your applications are submitted. And you'll also get some personalized emails from Montana Healthcare Foundation as well. The main login for that is on the Montana Healthcare Foundation website. And there's a login page, or a login button right on the upper left of that home page, and that'll take you to a login page at the Grant Administration. Oh, sorry. Yeah. So the login page here, the main thing we want to make sure here too is that if your organization has already set up an account, please check in your organization to make sure that your organization has not, so we don't duplicate organizations in our system. And if you need to change or add a user to your current organization, just call us and we can help walk you through that. And then large organizations, please, as you create a new account, make sure that for Montana State University or University of Montana, that you include the department that you're with and specify that as your organization name. That would be helpful as well. For organizations, we do accept 2 applications per year from our different processes. And here, as you log in and you hit apply, you'll see our different buckets that are different applications that you could choose from. There are different areas of focus. There's 8 of them. 4 are associated with the rapid response application and 4 with the large grant application. The questions vary a bit by application, either by the brief proposal or the rapid response, but generally you'll see a series of questions that are expanded. So if you click on these arrows next to eligibility and organizational information, that'll break into a series of questions, and there's 5 different groupings of questions that you'll need to answer. And eligibility focuses on the organization type, confirming our different eligibility criteria for your organization, brief descriptions of your organization mission. Onto that is a short project title and project summary. These are important to keep them concise and directed towards your project. That way we, when we run reports and we provide feedback on our website, you can get quick snapshots of what types of projects we have funded. From there, we do some more demographic information of what type of organizations you'll be working with and target populations. And then we'll go on to the project description. This will be the meat of the application, where you do describe your partners, your project activities, outcomes, sustainability plan, and work plan, a detailed work plan with timeline. These are the essential, information for us to make. And as you can see, these will pretty much follow our selection criteria and the types of questions we ask. And from there, we'll go on to the financial aspects of the application. So short narrative on your what you'll be using the Montana Healthcare Foundation funds for, the term of the grant, the amount, other contributions to the project. And here for the brief proposal, you'll see a link to download a budget template. For the rapid response, you'll see a link to download a budget template. For the brief proposal, that'll be in the second stage of the grant if you're invited to submit a full application. Please feel free to call on any questions as you navigate that. You can contact Ted or Kayla at the foundation, and they can help walk you through the application once you're logged onto the system. Thank you.
Thanks very much, Ted. Okay, so now you know a little bit about the types of projects that we're likely to fund and how to apply for grants. Let's talk about the timeline. For the rapid response grants, we expect to have 2 rounds of funding and possibly a third, depending on how competitive the first 2 are. The round 1 opened on February 2nd. Proposals are due on March 15th, and we expect funding decisions on April 15th or thereabouts. Round 2 opens on May 1st, proposals due June 15th, and we'd aim to make funding decisions on July 15th, again, or thereabouts. For the large grants, it's a 2-step application process. Again, the call opened on the 2nd of February. Brief proposals are due on April 15th. This is where you're going to sketch out your idea, but not necessarily provide all the details. By May 15th, we would hope to be making decisions on brief proposals. Then if we invite a full proposal from you, which we won't for every brief proposal received, only for the strongest one, we'd ask you to do a full proposal, much more in-depth proposal. For the largest grants, we'll be asking people to put together at least the start of a strong business plan for sustaining the project after our funding. And those full proposals would be due on August 15th. We'd expect to be notifying you then around September 30th of a final funding decision with a start date in November, most likely. Okay, we're going to go to the question and answer session. We've already got some questions pending. I'll start with those, but if you have more, please type your questions directly into the Q&A feature. It looks like everybody's been doing that so far. If you want specific questions, would we fund this project or that project, this is not the best forum for that. Try to frame your questions in a way that applies to a broad range of projects so that everyone will benefit from the answer. If you don't have the opportunity to ask your question today, or if we don't respond to it directly or well enough during our presentation, please email it to us and we'll get back to you as quick as possible. And as a reminder, this presentation and the Q&A session is recorded and will be archived on the website. Okay, Melinda, do we have some questions?
All right, we do. The first question we have is a 501c6 organization eligible to apply for a grant?
Ted, I think the answer is no, right?
Yeah, at this point we are not accepting those types of organizations. Those are more trade organization and they have different purpose and mission than the operating foundations or operating organizations we plan on funding. We encourage the C6s to work with their members at our C3s to look at our application process and encourage them to apply as individual organizations.
Okay. Can a non-tribal entity request funding under the American Indian Health Focus Area if they are serving tribal members?
No. So only tribal governments and tribally led nonprofits are eligible to apply under the American Indian Health Focus Area. We have occasionally funded projects in behavioral health or partnerships for better health that focus largely on an American Indian population. And in those, we've funded a non-tribal organization such as a major hospital to work with the tribes they serve. In those cases, I just point you to selection criteria under behavioral health and partnerships for better health. At the bottom of the selection criteria under collaboration with tribal leadership, if your project involves a substantial focus on American Indian populations, you must demonstrate support from and collaboration with the appropriate tribal health authorities, such as the relevant tribal councils, the health directors of the relevant tribes, or relevant urban Indian health centers. We really aim for our work with tribes to be controlled by American Indian leadership and at least very strongly guided and done through close partnership with tribes.
Okay, can an organization apply for both rapid response and large grant funds for different or the same projects?
Read the question again to make sure we get the right answer. This is sometimes nuanced.
Okay, I'm going to try this one again. So can one organization apply for both a rapid response and a large grant for different projects or for the same project?
So the answer is yes, choose a different project, and you can submit up to 2 proposals. Those could be 2 different rapid response proposals. They could be 1 rapid, 1 large. They could be 2 large grant proposals. But they really need to be different projects. Now, you could, for example, submit a proposal for a planning grant under the rapid response, or for a much larger implementation grant for a similar type of project. But if you've submitted planning grant, we're going to be looking at the larger implementation grant and saying, well, don't you need to plan it? So you do want to think, you don't want to just submit the same proposal twice. That won't benefit you.
And we encourage that if you submit 2 rapid response proposals, that they are under different processes. So 2 rapid response proposals or brief proposals with Partnerships for Better Health, we'd like to see those done in 2 different areas, focus areas.
Can our funds be used in conjunction with other funding sources to fulfill a project outcome?
Absolutely. We strongly encourage you to make contributions to the project you're seeking grant funds from us, either through another funder or through in-kind contributions of your own staff's time and effort on the project. What we will ask you to be very careful about describing is what specific outcomes will our grant allow you to achieve that wouldn't be possible with the other funds that you have. So we want to know, how is our grant contributing in a fairly specific way to the overall project that you're implementing with other sources of funding. But yes.
Okay. Is an organization only able to apply for 2 grants in total in a year, or 2 grants within each funding bucket per year?
2 grants total per year.
Right. I'm just going to grab some more questions. For some population, there are no known effective suicide prevention programs. Would a proposal looking at a potential prevention technique for specific populations be considered?
Scott, do you want to tackle the suicide prevention? Happy to chime in.
Yeah, I think that if I understand the question, it's can an organization apply to try and assist their community organization with the suicide issue, and how are we going to kind of view the specific treatment or approach that is being used? And I think that what the organization should be really looking at is what is available right now in the state of Montana that can assist them to approach the suicide in their community. And so being very aware of what is out there right now through the suicide prevention trainer, and then really look at the research that is out there as far as specific populations, specific risk groups, and what approaches are considered to be at least promising practice or best practice to try and apply to those risk groups, and then which agencies or which settings are most appropriate to apply those treatments or approaches to those risk groups.
And I'd just add that in general, we are not considering ourselves a major funder of research that's trying to generate new knowledge on an area. We aim for our grants to generate direct, immediate, tangible benefits for communities. So it is very possible for someone to try a new program to address a prevalent health issue in your community. But if we don't want it to be sort of hypothetical research. You would need to present a strong case for why you think the intervention you'd like to try will be effective in your community.
Okay, next question. Do we have to stay in one focus area, or can we address multiple focus areas in our grant request?
There is quite a bit of overlap between these focus areas. So for example, as you saw, the American Indian leaders told us that behavioral health is a major concern, and yet we have a whole focus area on behavioral health. So you can absolutely address multiple focus areas in a single grant request. Again, if your project seeks to focus on tribal populations, you need to make sure that you have very strong partnerships and support there.
And I guess I'd just add that you just try to find the best fit because each application is under an area of focus. So you just try to find the best fit that your application would fit under for that area of focus.
Next question is, what percentage of large grants are funded? And what percent of brief proposals are invited to apply for a full proposal?
Well, let's see. So we've had one competitive grant-making cycle, so we would have to give you an answer based on our numbers from last year. Last year we only did a two-step application, so whether you were applying for $10,000 or $100,000, it was a two-step application. We received about 150 proposals. We invited roughly 50 full proposals. We funded roughly 35 grants. So it's always hard to know how many we're going to receive this year. We do aim not to have too many people do the work that goes into a full proposal for a large grant unless we really think their project has a reasonable chance of success. So last time our ratio was a little bit better than 2 to 1. 2 to 1 or 3 to 1 is probably a cap on invitations to what we think as a ratio of invitations to number of proposals we think we can fund.
Next question is, do you have any suggestions for how to decide which type of grant to apply for, like the rapid response versus large grant? And is it a good idea to create an initial tentative budget for your project before deciding?
I think it is a good idea to have some rough budget in mind for your project, and that's part of developing your scope of work. I think ultimately the decision that should really drive whether you use rapid response or large grants is the budget that you honestly think you need to have a successful project. Bear in mind that we expect large grants to be somewhat more competitive, particularly the largest within those. So we won't give out very many $150,000 grants, but the large grants, remember, anything above $50,000 and up to $150,000. So you don't have to feel obligated to apply for $150,000 just because that's our max. Decide on what you need to do a successful project and go from there. If you're early in the planning for a major initiative and you're not sure exactly how you'd roll it out, maybe you want to apply for a rapid response grant to do planning. If you've got your coalition and partners established, you're ready to press go and you just need a big grant to implement a great project, maybe you're ready for a large grant. Any other thoughts, Ted or Scott? Okay.
All right, our next question is how many applications can a university submit?
A university can submit 2 proposals.
Would this funding be able to be used for training and technical assistance to communities? For instance, training on health impact assessments so organizations and local governments can use this tool to make better decisions related to health disparities.
So again, we won't comment on specific project ideas, so nothing in my answer should be construed as an endorsement of the specific idea that you outlined there, or not, or a rejection of it. But I think in general, recall that all of our grants should show themselves capable of producing direct, tangible health benefits for the community. If training and technical assistance is the route that you think you need to take to get there, then you just need to explain in the application how providing that training and technical assistance would result in improvements in the health problem that you've identified.
Next question is, rural and frontier communities have limited behavioral health providers. Would the use of telehealth fit in the parameters of an integrated approach?
Yes, telehealth is obviously something in Montana that's very relevant, and I would also say that one of the grantees from last year, with again the description is on our website, is using telehealth to implement a school-based health center, which includes virtual or telehealth for their psychiatrist. So again, we want to make sure that the approach that is being applied for is relevant to the community and the people that are being served there. And in many of our frontier communities, we very much understand that telehealth is going to be something that is used.
Next question is, would the Foundation consider incarcerating youth with a mental health diagnosis as a public health issue, which could be addressed by projects that partner with juvenile probation, law enforcement, and courts, be viewed as addressing a health issue?
So again, I think we will refrain from commenting on specific proposals, but in general, incarceration of people with mental illness is a problem that we've identified as a major concern in Montana and far beyond. And so proposals that would seek to address the health issue presented there in an effective way would certainly fall within the behavioral health focus area, and you would just want to pay attention to the selection criteria as you thought about how to construct the intervention.
Our next question is, can collaborating entities each apply for funding in the same focus area and for the same project?
We would be unlikely to fund two entities to do the same project if it's clear it's the same. So you could certainly apply, but again, if it's the same proposal just coming from two separate organizations, I'm not sure that submitting to those separate applications would benefit you. You can use part of your grant budget to support your partners, and we strongly encourage you to do so. So they're not partners in name only, they're partners that have active deliverables and engagement in the project. Anything to add there, Ted?
No, I think.
Okay.
All right, our next question is, our organization was involved in a partnership that was awarded a planning grant during the last funding cycle. Would it be appropriate to move toward the IBH implementation grant, even if the partner is less involved and this application is more internal?
I think you should look at the selection. Well, Scott, you may have thoughts too, so chime in. You should look at the selection criteria for the behavioral health focus area and the specific description of the implementation grant. We certainly want to understand the work that you've done under the planning grant and why you're moving in the direction that you propose to move in the implementation grant. But nothing on the face of what you've said would keep you from applying for the implementation grant. I think we would just need to understand the specifics.
Our next question is, can a 501c3 organization partner with a non-501c3 for this project and qualify for the grant?
So the one thing that you can't do if you're an eligible applicant, i.e. if you're a 501c3 that wants to apply for our funding, you can't simply be a pass-through to a non-eligible organization. You can have a partner who's not eligible, so it could be a private individual consultant, it could be a for-profit consultant, it could be a 501c6, and you can include that in your consulting budget. But if it seems clear that really you're being used simply to pass grant money through to an organization that isn't eligible, and you don't have a substantial role, the applicant organization doesn't have a substantial role in the project, that is probably not a project that we would fund.
I think we've got through everything we have so far. Are there any more last-minute questions?
We have about 2 minutes left, so type fast if you have another one. Otherwise, I'll start wrapping up just by saying thank you very, very much for attending. Please consider this the start of our conversation with you, not the end. We try to be as accessible as possible, and